Martin, à vous la parole.
Good afternoon, everyone. Welcome to this technical briefing on the COVID-19 vaccine rollout. Bienvenue à ce briefage technique sur les vaccins contre la COVID-19. We'll start with Dr. Howard New. Dr. New, à vous la parole.
You have the floor.
Okay, thank you, merci. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Dany Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada, as well as Dr. Tom Wong, Chief Medical Officer of Public Health, Indigenous Services Canada. We will each provide brief remarks and then open the floor to your questions. To assist us in answering your questions, we have with us Joël Paquette, Director General responsible for vaccine procurement from Public Services and Procurement Canada. I'd like to acknowledge that we're here today on the eve of the one-year anniversary of the World Health Organization's declaration of this pandemic. COVID-19 has taken a heavy toll on all of us, particularly seniors, those who are marginalized, and frontline healthcare workers. Today, we take a moment to recognize that essential workers and other leaders in our communities contributing to the national effort to end this pandemic. Better days are ahead. To date, more than 2.5 million doses of COVID-19 vaccines have been administered in Canada. And with last week's announcements of Health Canada's approval of the single-dose Janssen vaccine and accelerated vaccine shipments from Pfizer, Canada's vaccine rollout continues to ramp up every day. Canadians have good reason to be optimistic about this next phase of our vaccine rollout. The COVID-19 vaccines authorized for use in our country are safe and effective and are an important tool to help us lower the rates of infections, severe illness, and deaths. Because we want to make sure that everyone in Canada has access to credible information about COVID-19 vaccines, the recently launched Vaccine Community Innovation Challenge will fund creative ideas for communications campaigns to raise awareness of the importance of the COVID-19 vaccines in underserved, Indigenous, and racialized communities. Individuals in these groups may feel hesitant about getting vaccinated due to past experiences of discrimination or abuse, or lack of information in their language. They may also face barriers in accessing immunization due to health inequities or remote locations. We want to help communities create their own content in their own languages and formats to help people make informed decisions about COVID-19 vaccination when their turn comes. Every day, we continue to learn more about COVID-19 vaccines and the protections they provide. As more real-world data becomes available, our guidance and recommendations will evolve accordingly. With the spread of variants of concern accelerating, Canada is aiming to vaccinate as many people as possible with at least one vaccine dose as quickly as possible. As we approach the one-year mark of this pandemic and people across the country roll up their sleeves for the vaccines, the continuing practices of personal public health measures such as physical distancing, mask wearing, and hand washing will continue to be important. It may be part of our lives for some time. The virus does not know if you live or work in a red, yellow, or green zone. It is still present, and we must all remain vigilant. Thank you. Bonjour à toutes et à tous de vous joindre à nous aujourd'hui pour assister à la séance d'information technique sur le déploiement du vaccin contre la COVID-19 au Canada. Je suis accompagné de Maj General Dany Fortin, vice-président des opérations et de la logistique à l'Agence de la santé publique du Canada, ainsi que Dr. Tom Wong, médecin hygiéniste en chef,
Chief Medical Officer of Public Health, Indigenous Services Canada. We will each provide brief remarks and then open the floor to questions. To assist us in answering your questions, we have with us Joël Paquette, Director General responsible for vaccine procurement from Public Services and Procurement Canada. I'd like to acknowledge that we're here today on the eve of the one-year anniversary of the World Health Organization's declaration of this pandemic. COVID-19 has taken a heavy toll on all of us, particularly seniors, those who are marginalized, and frontline healthcare workers. Today, we take a moment to recognize the essential workers and other leaders in our communities contributing to the national effort to end this pandemic. Better days are ahead. To date, more than 2.5 million doses of COVID-19 vaccines have been administered in Canada. With last week's announcements of Health Canada's approval of the single-dose Janssen vaccine and accelerated shipments from Pfizer, Canada's vaccine rollout continues to ramp up every day. Canadians have good reason to be optimistic about this next phase of our vaccine rollout. The COVID-19 vaccines authorized for use in our country are safe and effective and are an important tool to help us lower the rates of infections, severe illness, and deaths. Because we want to make sure that everyone in Canada has access to credible information about COVID-19 vaccines, the recently launched Vaccine Community Innovation Challenge will fund creative ideas for communications campaigns to raise awareness of the importance of the COVID-19 vaccines in underserved, Indigenous, and racialized communities. Individuals in these groups may feel hesitant about getting vaccinated due to past experiences of discrimination or abuse or lack of information in their language. They may also face barriers in accessing immunization health due to health inequities or remote locations. We want to help communities create their own content in their own languages and formats to help people make informed decisions about COVID-19 vaccination when their turn comes. Every day, we continue to learn more about COVID-19 vaccines and the protections they may provide. As more real-world data becomes available, our guidance and recommendations will evolve accordingly. With the spread of variants of concern accelerating, Canada is aiming to vaccinate as many people as possible with at least one vaccine dose as quickly as possible. As we approach the one-year mark of this pandemic and people across this country roll up their sleeves for vaccines, the continuing practice of personal public health measures such as physical distancing, mask wearing, and hand washing will continue to be important and may be a part of our lives for some time. The virus does not know if you live or work in a red, yellow, or green zone. It is still present, and we must all remain vigilant. I will now invite Major General Fortin to provide comments on vaccine rollout logistics. Thank you.
Merci, Dr. New. Bonjour à tous.
Thank you, Dr. New. Good afternoon, everyone.
We have distributed 3.8 million doses of vaccines to provinces and territories to date, and numbers are rapidly increasing. In total, by the end of March, Canada will have received 8 million vaccine doses from suppliers. So here are the details. The deliveries of 444,000 doses of Pfizer-BioNTech this week are nearly complete. We will see a substantial increase in deliveries after next week. Pfizer-BioNTech will be delivering doses to Canada ahead of schedule. This means that starting March 22nd, we will now receive over 1 million doses of Pfizer-BioNTech weekly through April. So this is great news. To be clear, for the weeks of March 22nd and March 29th, we'll be getting respectively 1.2 million doses. For the weeks of April 5th and April 12th, it will be more than 1 million doses each week, and we expect similar quantities in the following weeks. In total, by the end of March, Canada will have received 5.5 million doses of Pfizer-BioNTech. As for Moderna, this week's shipment of 466,000 doses is expected to arrive tomorrow, and deliveries will be taking place starting Friday. We are still expecting a shipment of 846,000 doses the week of March 22nd. As for shipments going into April, Moderna has recently confirmed our first shipment estimated at 855,000 doses for the week of April 5th, and our second shipment is estimated at more than 1 million doses in the week of April 19th. Last Wednesday, Canada received an initial 500,000 doses of the Oxford-AstraZeneca vaccine manufactured at the Serum Institute of India. The deliveries of those doses are well underway. They're, in fact, almost all distributed now. The Serum Institute of India has also confirmed additional doses will arrive from India in the coming months, with 1 million doses expected in April and 500,000 expected in May. Recently, Health Canada authorized an additional COVID-19 vaccine for use in the country. Single-dose vaccine, yes, from Johnson & Johnson. We're working closely with the company to confirm quantities and a delivery schedule. So we'll share additional information when we know more. To maintain our readiness, yesterday we conducted a rehearsal of the next phase, along with more than 180 participants from federal, provincial, territorial, Indigenous partners, as well as industry stakeholders. The goal was to validate the planning and infrastructure to handle the phase where we see larger quantities of vaccines and new vaccines being available, which is starting earlier than initially anticipated. This was needed to ensure provinces are prepared and ready for an increased shipment size of authorized COVID-19 vaccines. So the rehearsal of concept allowed us to visualize our relative roles in the ramp-up phase, to build confidence in the overall conduct and execution of this complex, multifaceted plan. Provinces shared insights on collaborative planning with Indigenous partners, on reaching out to racialized and marginalized populations, scheduling appointments, generating solutions to health workforce challenges, and more. In parallel efforts, the provinces confirmed the practical readiness of designated immunization clinics. So provinces have assured us that they're in a very good position to scale up. As you can see, Canada is getting ready to go into the ramp-up phase after a steep increase in vaccine availability. This includes 25 million doses of Pfizer-BioNTech and Moderna between April and June, and at least 1.5 million of AstraZeneca vaccine arriving by mid-May. More vaccine doses are coming online, such as AstraZeneca and Johnson & Johnson. We'll communicate quantities and delivery schedule once we have more visibility from the manufacturer on the expected size of shipments. Alors, bonjour à tous. À ce jour, nous avons distribué près de 3,8 millions de doses de vaccins aux provinces et territoires, et leur nombre augmente rapidement.
And numbers are rapidly increasing.
Au total, d'ici la fin mars, le Canada a reçu
by the end of March, Canada will have received 8 million
de doses de
vaccine
vaccins
doses
de la
from
part des fournisseurs.
suppliers.
Alors, voici les détails.
Here are the details.
La livraison des 444
The
000 doses
deliveries
de
of
Pfizer-BioNTech cette semaine
444,000
sont
doses of
presque
Pfizer-BioNTech
terminées.
this
Nous
week
verrons une
are nearly
augmentation
complete. We will see a substantial increase after next week.
Pfizer-BioNTech livrera des doses
Pfizer-BioNTech
au
will be
Canada plus tôt
delivering
que prévu.
doses to Canada ahead
Ça
of schedule.
signifie qu'à partir du
This
22
means that
mars, nous
starting March
recevrons désormais
22nd, we will now
plus d'1
receive
million de doses
over
de
1 million
Pfizer-BioNTech
doses of
chaque semaine d'ici la fin
Pfizer-BioNTech
avril.
weekly through
C'est une
April.
excellente
This is
nouvelle.
great news.
Pour être clair, donc, pour
To be
les semaines
clear,
du 22
for the weeks
et
of
du
March
29
22nd and
mars,
March 29th,
nous attendons de
we
recevoir
will be
respectivement 1,2 million
getting
de doses.
respectively
Pour les
1.2
semaines
million
du 5 et
doses.
du 12
For the
avril,
weeks of
ce sera
April
plus d'1
5th
million
and
de
April
doses qui nous
12th, it will
seront
be more
fournies
than 1 million doses each
par
week.
semaine. Nous attendons
We
des
expect
quantités
similar
similaires
quantities in
dans
the
les
following
semaines
weeks.
suivantes. Alors, au total, à la fin du
In
mois de
total, by
mars,
the end of
le
March,
Canada a
Canada
reçu
will have received
5,5
5.5
millions
million
de doses
doses
de Pfizer-BioNTech.
of Pfizer-BioNTech.
Quant à Moderna,
As for
l'envoi de
Moderna,
466
this
000
week's
doses cette
shipment of
semaine devrait arriver
466,000
demain et
doses
les
is
livraisons
expected to arrive
commenceront
tomorrow,
vendredi.
and deliveries will
Nous
be taking
attendons
place
toujours une
starting
livraison de
Friday.
846
We
000
are still
doses
expecting a shipment of
pour la semaine du 22 mars.
846,000 doses the week of
En ce
March
qui concerne les
22nd.
livraisons du mois
As
d'avril,
for shipments going
Moderna a
into
récemment
April,
confirmé
Moderna
notre
has
première
recently
livraison
confirmed
estimée à
our first shipment,
855 000
estimated
doses
at
pour la semaine du
855,000
5
doses
avril.
for the week of April
Et notre
5th,
deuxième
and our
livraison
second
est estimée
shipment
à
is
plus de 1
estimated
million
at
de
more than
doses
1
pour
million
la semaine du
doses
19
the
avril.
week of April 19th.
Mercredi dernier, le Canada a reçu une première
Last
série de
Wednesday,
500
Canada
000
received an
doses
initial
du vaccin
500,000 doses of the
Oxford-AstraZeneca fabriqué
Oxford-AstraZeneca
au Serum
vaccine
Institute en Inde.
manufactured at the Serum Institute
La
of
livraison
India.
des doses est en bonne voie.
The
En fait, elle
deliveries
est
of
presque
doses are
terminée.
well underway.
The Serum Institute
of India has also confirmed additional doses will arrive from India in the coming months,
dans les mois à venir, avec 1 million de
with
doses
1
attendues
million
en
doses
avril
expected in
et
April
500,000 en mai.
and 500,000 in May.
Récemment, Santé Canada a
Recently,
autorisé
Health Canada
l'utilisation d'un
authorized an
autre vaccin
additional
COVID-19 au
COVID-19
pays,
vaccine for use
un
in the
vaccin à
country,
dose unique de Janssen et
a
Janssen.
single-dose vaccine
Nous
from Johnson
travaillons
&
en
Johnson.
étroite collaboration
We are
avec la
working
société
closely
pour
with the
confirmer les
company to
quantités
confirm
et le
quantities
calendrier de
and the
livraison.
delivery
Alors,
schedule.
nous communiquerons l'information
We will share
supplémentaire lorsque nous en
information when
saurons
we know
plus à ce
more.
sujet. Pour maintenir notre état de
To maintain
préparation,
our
nous avons
readiness,
procédé
yesterday we
hier à une
conducted a
répétition de la prochaine
rehearsal of the
phase avec
next
plus de
phase, along with more
180
than
participants
170
et
participants from federal,
partenaires
provincial,
fédéraux,
territorial,
provinciaux,
Indigenous partners,
territoriaux et autochtones, ainsi que des
as
parties
well as
prenantes de
industry
l'industrie.
stakeholders.
L'objectif était
The
de
goal
valider
was
la
to
planification
validate
de
the planning
l'infrastructure nécessaire
and
pour gérer la
infrastructure
phase
to
où nous voyons
handle
de plus
the
grandes
phase where we
quantités de
see
vaccins,
larger quantities of
ainsi que l'arrivée de
vaccines and
vaccins
new
nouvellement
vaccines
homologués.
being available,
Alors,
which
c'est
is
une phase
starting
qui commence
earlier
plus
than
tôt que prévu
initially
initialement.
anticipated.
Cette étape était
This was
nécessaire pour
needed to
s'assurer que les
ensure
provinces sont
provinces
prêtes à
are
faire face à
prepared and
l'augmentation
ready
de la taille des
for
envois
the
de vaccins
increasing
COVID-19
shipment
autorisés.
size of
La
authorized
répétition du
COVID-19
concept nous a donc
vaccines.
permis de
The
visualiser
rehearsal of
nos rôles
concept
respectifs dans la
allowed
phase
us to
d'accélération,
visualize our relative roles
renforcer
in
la
the ramp-up
confiance dans la
phase
conduite et
and to build
l'exécution
confidence in the
globale de
overall
ce plan
conduct and execution
complexe
of
et à
this
multiples
complex,
facettes.
multifaceted plan.
Les provinces ont partagé leur
The
point de vue sur la
provinces shared
planification en
insights
collaboration avec les
on
partenaires
collaborative
autochtones,
planning with Indigenous
sur la
partners,
manière d'atteindre les
on
populations
reaching out to
racialisées et
racialized and
marginalisées,
marginalized
de
populations,
fixer des rendez-vous, de
scheduling
trouver des solutions
appointments, and
aux problèmes de
generating
personnel de santé.
solutions to health
En
workforce
parallèle, les provinces ont
challenges.
confirmé que
In
les cliniques
parallel
de
efforts, the
vaccination
provinces
désignées étaient
confirmed the
prêtes à
practical
intervenir
readiness
dans la
of
pratique.
designated immunization
Les provinces
clinics.
nous assurent qu'elles
The
sont en très bonne
provinces
voie
have
pour faire
assured
face à
us
cette
that they are in
augmentation.
a very good position to scale
Alors,
up.
comme vous pouvez le voir, le Canada se
As you
prépare à
can
entrer dans la
see,
phase
Canada is getting
d'accélération
ready to go into the
après
ramp-up
une forte
phase after a
augmentation de la
steep
disponibilité
increase
des
in
vaccins.
vaccine availability.
Ça comprend 25
This
millions de
includes
doses
25 million doses
de
of
Pfizer-BioNTech et
Pfizer-BioNTech
Moderna entre avril et
and
juin.
Moderna
Et au
between
moins
April and June, and at
1,5
least
million
1.5
de doses
million
du vaccin
doses of the
AstraZeneca
AstraZeneca
qui arriveront
vaccine arriving
d'ici à fin mai.
by mid-May.
Alors, d'autres doses de
More
vaccins sont
vaccine
en
doses are
cours
coming online,
de mise en ligne, comme
such
AstraZeneca et
as
Johnson Johnson.
AstraZeneca and Johnson & Johnson.
Nous communiquerons les
We will
quantités dès que
communicate
nous
the
aurons visibilité
quantities
sur
and
ces
delivery
quantités
schedule
et nous aurons
once
visibilité
we
sur le
have more
calendrier
visibility from the
de
manufacturer
livraison du fabricant.
on the expected shipments. Thank you.
Merci, Maj General Fortin.
Thank you, Maj General Fortin.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. It is exciting to see that First Nations on reserve newly reported COVID cases have dropped by over 70% in the past 2 months. As of March 9th, over 162,000 doses of the vaccine have been administered in 506 communities. The vaccine administration rate for adults in First Nations and Inuit communities in the provinces and residents in the territories is over 5 times the rate in the overall Canadian adult population. Through optimizing vaccine distribution, more Indigenous peoples will have the opportunity to be vaccinated. Providing the first dose of the vaccine to as many people as possible will save lives and enable us to hug our family sooner. In the meantime, it is prudent to follow public health advice, such as wearing masks, avoiding crowds, and avoiding gatherings, and proper hand hygiene to reduce the spread of COVID-19. Operation Remote Immunity in Ontario has finished administering first doses of the COVID-19 vaccine to 31 fly-in remote Northern First Nations communities. As of March 7th, over 15,000 doses have been administered. That is 84% of the adult population in the 31 communities have received the first dose of the vaccine, and some are starting to get the second dose. This was made possible through collaboration between Indigenous leaders, frontline healthcare workers, Orange, and the province of Ontario. It has been 1 year since the pandemic started, and I want to acknowledge the unwavering efforts of frontline workers, community leaders, community members to get ahead of COVID-19. Pendant ce temps, la santé mentale reste
During this time,
importante
mental health
pour
remains
le bien-être.
important to overall
C'est
well-being.
pour cela que
It is
C'est
essential
essentiel de garder le
to reach out
contact
to loved
avec les
ones
autres autant que possible.
as much as possible
Nous
and stay in
vivons
touch with others
toute
virtually
la
when
même
possible.
chose ensemble.
We are all in
We
this
are
together.
in this together. Miigwech, Nakumik, merci, et thank you.
Merci, Dr. Wong. We'll now move to the question and answer period. As usual, we ask that you please limit yourselves to one question and one follow-up. Please identify yourself and your media outlet. Vous pouvez poser votre question et une question de suivi dans la langue officielle de votre choix. Je vous demanderai de vous nommer et de vous dire quel média vous représentez. Opérateur, à vous la parole.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. The first question is from, la première question est de Mia Robson de Canadian Press. Please go ahead, à vous la parole.
Thank you. Major General Fortin, I'm wondering if you could walk us through how we go from 3.8 million that you said have been distributed to 8 million by the end of March. I'm trying to add up the numbers that are on the website, and it's not quite getting to 8. So I'm just wondering if you can walk us through how we're going from 3.8 million to 8 million by the end of March.
So as of today, 3.8 million, that's correct. We'll receive over the next full weeks of March, because we have 5 weeks this month. We'll receive 444,000 Pfizer alone next week, and then it's slightly over 1 million, as I said before, 1.2 million each week. 1 million through April, although that's not part of your question. That's a good projection. And we have line of sight on 1.2 million of Moderna, including what is just about to arrive. So when all added up, you get to 8 million.
Okay, so this week's Moderna is not already included in that 3.8, I guess. My follow-up question is either for Dr. New or maybe Dr. Wong. I'm just wondering if you can update us at all on how concerned you are about fake vaccines that are being delivered, how many incidents we've had of people being offered fake vaccines, and what sort of warnings you can give to people to avoid being duped by them.
It's Dr. New. Maybe I can start. Yeah, certainly within the Public Health Agency of Canada, we're well aware of some of these sort of marketing or sort of offers through email, internet, and so on of fake vaccines. And certainly we've asked our partners, our counterparts, our colleagues in provinces, territories that if they become aware of them, please to forward that information to us. And we've then forwarded it to the appropriate authorities for sort of further follow-up from a legal perspective, because certainly we understand and we know it's important that Canadians should have confidence when they go to get a vaccine that it's an authorized, approved vaccine, and certainly it's done in sort of the proper way through the clinics and other venues administered through provincial authorities. So once we become aware of these types of sort of a fake vaccine marketing and so on, we certainly have forwarded that to the appropriate authorities. I'm not sure if Dr. Wong has anything additional to add.
Yeah, I want to echo what Dr. New just said. We work closely with Public Health Agency of Canada, Health Canada, as well as security departments, to make sure that the public is not being taken advantage of by fake vaccines. Thank you.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Mélanie Marquis de la Presse. Please go ahead. À vous la parole.
Merci. Bonjour. Ma question est pour le Dr. New. On a la conférence des évêques catholiques du Canada, qui invite les Canadiens à éviter les vaccins d'AstraZeneca et de Janssen en raison de la façon dont ils ont été développés, dont ils sont produits, donc à partir de lignées cellulaires dérivées de l'avortement. Craignez-vous que... qu'est-ce que vous pensez de ça? Puis craignez-vous que ça ralentisse l'effort de vaccination de masse au pays?
That will slow down the vaccination efforts across the country?
Premièrement, c'est peu comme
first of all,
décevant, c'est que c'est la misinformation.
Disappointing because that's misinformation.
C'est pas vrai ce que vous avez dit concernant comment les vaccins ont été développés. Tous les vaccins sont sûrs et efficaces.
Developed that way. The vaccines are safe and effective. There should be no concerns that people should have before accepting them.
On a un peu de travail
so I think we have a bit of work to do.
Disséminer la bonne information fiable et crédible,
disseminate reliable information to Canadians to increase their level of understanding of vaccines. Aside from that,
je pense que tous les vaccins sont très efficaces. Maintenant, on est chanceux au Canada. On a 4 vaccins homologués, approuvés. Et je pense que pour les provinces et territoires, on a vraiment plusieurs options parce que quelques vaccins aussi sont plus faciles, je pense, à manipuler pour aussi peut-être distribuer dans leur infrastructure pour un système de soins de santé. Donc, je pense que pour les Canadiens, partout dans le pays, si on offre un vaccin, c'est vraiment c'est bonne décision pour moi
the right decision to accept any vaccine.
On peut faire se vacciner.
To get vaccinated. Thank you.
Je comprends, mais
yes, I understand.
En suivi,
but in follow-up, two things.
Ce que la conférence affirme, c'est que
what
les
the
deux
conference
vaccins,
has
donc
said is that AstraZeneca and Johnson vaccines
are
fabricated or developed
cellulaires dérivées de l'avortement. Donc,
using DNA material that was from abortions. Can you confirm whether they have correct information? And if it's not an ethical or religious question, is it something that's acceptable?
OK, peut-être que je n'ai pas bien compris la question.
Answer.
Mais,
perhaps I didn't correctly understand the question.
Trouver,
but I can always find the information to confirm. But in my opinion, with the information that I have to date, no. The vaccines were not developed in the way that you described. I don't think it's really a concern, even for those who are religious. I didn't know the second part of your question. Can you repeat it?
En fait, premièrement, ce serait
first of all, it would be,
je vais évidemment me tourner du côté des manufacturiers là, pour valider
l'information. For misinformation.
Que vous puissiez me confirmer. Puis, en fait, la deuxième question, c'était à savoir est-ce que ça rend la chose acceptable le fait que ce soit un choix moral, éthique, religieux.
Is a moral or religious choice on the matter.
Pour se faire vacciner en général?
Answer, to be vaccinated in general, that's the question? The fact that the conference of Catholic bishops, is this statement justifiable or not, in your opinion?
Moi, je peux pas commenter.
Answer. I can't comment on it. Perhaps I don't understand all perspectives. Any organization or religious group may have a different perspective. I'm giving you the public health perspective. We know that with COVID-19, vaccines and vaccination are a very important tool and an effective one to protect
tout le monde, aussi pour
eux-mêmes
et aussi pour leurs familles
and their families
leurs amis. Et je pense que c'est un moyen que tout le monde doit prendre avantage. C'est sûr, c'est une décision comme c'est bien informé.
We need to make well-informed decisions.
Même peut-être que les groupes religieux
and even religious groups maybe have questions or concerns,
c'est important, on peut avoir des
and
conversations.
it's important to have, we can have conversations or give tools to doctors or other healthcare providers so that they're able to answer questions. I think that it's very important to always give reliable, credible information to anyone so that people feel at ease to make an informed decision to get vaccinated.
Merci. Prochaine question.
Thank you. Next question.
Merci. The next question is from La prochaine question est de Mackenzie Gray de CTV News. Please go ahead. À vous la parole.
Hi there. My first question is for Major General Fortin. On a couple of days ago, the Prime Minister said that he was expecting there were going to be delays in Johnson & Johnson vaccine coming to Canada. J&J is only giving 400,000 vaccines to the U.S., and it seems like they have pretty substantial production issues. Can you tell us if there's any ballpark time when we can expect a first dose to come to Canada from Johnson & Johnson? And how much are the delays going to impact Canada, and what has the company told you about that?
Well, I can start answering this question, but I'll have to defer to my colleague from PSPC. What I would tell you is we're working with forecasts that are confirmed by manufacturers. At this time, I do not have numbers and exact dates of shipments for Johnson & Johnson product. What I do know, of course, is that it's been approved by Health Canada regulators. I'm very much focusing, and my team is focusing on the delivery of the approved vaccines, the vaccines that are now arriving by millions. But PSPC colleagues may have a little bit more to share on Johnson & Johnson.
Thank you for the question. Actually, we're continuing to engage with Johnson & Johnson on their delivery schedule and access to early doses. We'll provide an update when we have further information. Thank you.
I'd like to ask as a follow-up similar questions about AstraZeneca. I know that we're getting the bulk of our AstraZeneca doses, the 20 million from the U.S. It's not even approved in the U.S. so far, so they don't seem to have the same production issues that Johnson & Johnson has. I know that they've had some, but I don't understand why we haven't been able to get any of those 20 million from the U.S. Can you shed any light on that?
Again, we're in communication with AstraZeneca on their doses through their bilateral agreement, and we will provide an update once we have that information.
Thank you. Merci. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Louis Blouin de Radio-Canada. Please go ahead. À vous la parole.
Bonjour, question, je crois pour le docteur Fortin, mais Monsieur Nou, n'hésitez pas si vous voulez ajouter quelque chose. Vous y avez fait référence tout à l'heure, le rythme de vaccination va devoir augmenter dans les provinces pour atteindre cette cible de septembre de tous les Canadiens qui souhaitent pour qu'ils soient vaccinés d'ici septembre. On a fait nos petits calculs maison et selon nos conclusions, il faudrait que le rythme actuel de vaccination au Canada triple pour atteindre l'objectif de septembre. Alors, ma question, au plus fort de l'opération de vaccination,
at the peak of the vaccination efforts, in your opinion, how many people will be vaccinated in Canada to reach this September goal?
Je ne sais pas, est-ce que c'est Major General Fortin qui peut-être qui peut commencer?
Is it Major General Fortin who wanted to start? This is Dr. New, and I think it's maybe a logistics question.
Alors, je dirais, j'espère que les provinces vont tripler, quadrupler, quintupler leur capacité d'immuniser les Canadiens.
Their vaccination of Canadians.
Ce qu'on s'attend, c'est certainement ce que les provinces nous indiquent qu'ils ont l'intention de faire. Ils sont,
we're waiting for the provinces to indicate what they plan to do. They are aligning their resources
d'une façon considérable
to considerably increase their capacity to immunize Canadians.
Certaines semaines, à coût de 2 millions de doses distribuées au pays. certainement s'attendre à ce que les provinces, avec cette capacité de prévoir ces quantités, les distribuer d'une façon efficace en collaboration avec le fédéral et puis administrer le plus rapidement et efficacement possible. Alors, les provinces nous indiquent qu'ils sont prêts pour des quantités significativement plus importantes que ce qu'on a reçu à date. Et puis, tout porte à croire qu'on est en bonne posture. Maintenant, on continue de travailler étroitement ensemble pour faciliter autant qu'on peut du côté fédéral, peut-être faire appel davantage aux ressources fédérales, incluant notre fournisseur de services logistiques, pour vraiment assister autant que possible les provinces dans leur plan d'immunisation.
C'est peut-être Dr. New, peut-être ajouter quelque chose d'autre. On sait déjà que notre Premier ministre a toujours constaté une date, le mois de septembre, pour avoir tous les Canadiens au moins avoir une offre de la vaccination. Et je pense qu'on travaille toujours avec ça, avec toutes les bonnes nouvelles, l'approbation de plusieurs vaccins, aussi la livraison de plusieurs millions de doses qui arrivent peut-être plus tôt. C'est possible, on peut peut-être changer la date, mais on sait aussi qu'il y a toujours aussi peut-être des conséquences ou des événements imprévisibles et on ne sait pas ça. Donc, je pense que si on parle toujours pour l'instant, pour le mois de septembre, et si on arrive plus tôt à vacciner ou au moins offrir la vaccination à tous les Canadiens un peu plus tôt, ça c'est mieux.
Then that's all the better.
Et aussi, peut-être une autre chose, peut-être finir la question de Mélanie Marquis. J'ai oublié aussi de répondre que part des données outils aussi aux fournisseurs de la santé, l'Agence de la santé publique, on a déjà commencé une série aussi avec des séances d'information aussi avec les groupes religieux et aussi des autres organismes parce que c'est pas seulement une question avec des Canadiens individuels, mais aussi avec les organismes. Donc, c'est quelque chose et c'est en train de dérouler. On continue avec notre série des séances d'information.
We are hosting information sessions for them as well. Thank you.
J'aimerais vous relancer sur deux éléments. Alors, juste pour compléter, M. Fortin, je suis sûr, est-ce que vous avez une cible précise de nombre de personnes qu'il faudrait qu'ils soient vaccinées au Canada? Est-ce qu'on vous a demandé que l'armée, la Croix-Rouge vienne en renfort? Est-ce que vous avez une demande officielle? Et pour M. New, quelles sont vos estimations du nombre de Canadiens ou de la proportion de Canadiens qui voudront se faire vacciner?
Who will get vaccinated?
Alors, on a partagé avec les provinces des projections de quantité au cours du prochain trimestre et du troisième trimestre. Les quantités de vaccins selon notre compréhension des quantités qui devraient être disponibles par les manufacturiers et les nouveaux vaccins qui arrivent en ligne. Alors, ces quantités, les données de Statistique Canada en termes de population éligible à être vaccinée, de population adulte, sont des données importantes pour les provinces pour faire leur planification. Chaque juridiction est responsable de son plan d'immunisation. Alors, c'est davantage une question qui devrait être posée aux différentes provinces d'identifier comment ils ont l'intention d'administrer ces vaccins, que ce soit avec des super sites, des méga-cliniques, des cliniques ambulantes, des cliniques temporaires, des cliniques avec, comment on dit ça, des drive-thru. En bon français. Alors, il y a différentes options que les provinces sont en train de mettre en place. Certaines provinces vont faire davantage appel aux pharmacies pour les différents produits. Alors, tout ça mis ensemble, c'est des données sur lesquelles on continue de travailler. Les provinces ont ces projections. On va avoir un outil très prochainement qui va leur permettre de raffiner ces projections pour pouvoir vraiment voir si ils sont sur la bonne voie en termes de capacité selon la cadence prévue, la cadence de livraison prévue. En ce qui a trait aux forces armées canadiennes, la Croix-Rouge canadienne, il y a effectivement des plans de contingence où les forces armées canadiennes peuvent appuyer avec services aux Autochtones,
with Indigenous
principalement dans les
services
communautés
mainly
éloignées. Je pense que
in
le
remote
Dr.
communities. I
Wong a
believe
déjà
that
commenté
Dr.
là-dessus
Wong
par le
has already
passé.
commented on that in the past.
Alors, je ne vais pas parler
So
au nom
I
des Forces
won't
armées
speak on
canadiennes,
behalf
mais
of
je
the
peux vous
Canadian Armed
assurer que le
Forces, but I
message,
can
c'est que
reassure
les
you
Forces armées
that the
canadiennes
message is that
seront
the
prêtes
Canadian Armed
à
Forces
appuyer
are ready to
au besoin,
support
sont toujours là pour aider
as
les
needed.
Canadiennes,
They are
les
always here
Canadiens.
to help Canadians.
La Croix-Rouge,
The
au
Canadian
même
Red
titre,
Cross,
sans vouloir commenter pour eux, je sais
similarly,
très bien qu'il
without
y a des
speaking on their
plans, on travaille
behalf, I know
étroitement
that there
ensemble.
are
Ils ont
plans that
des
we've
gens
worked together closely,
identifiés,
and
préparés
people are
pour
ready
continuer d'aider
to
en termes de vaccination.
help with the vaccination efforts
Si
if
les
needed,
provinces en font la demande.
if the provinces make the request.
OK, merci. Et c'est Dr. New
Thank you.
maintenant.
It's Dr. New.
Écoute,
Well,
la
listen,
COVID-19
COVID-19
en général, c'est une nouvelle maladie
in general
infectieuse.
is a
Et
new
on
infectious
est en
disease.
train encore d'apprendre
We are
avec
still
les données probantes
learning
d'expérience dans
with
plusieurs
scientific
pays à travers le
data
monde et même ici au Canada.
a number of
C'est
countries
quoi
around the world,
l'impact de la vaccination? Donc,
what the
je
impact
pense
of
aussi avec
vaccination is.
aussi
So
l'apparition des
I
variants
think with
préoccupants, il y a
the
plusieurs facteurs. Je pense que
arrival
c'est
of
pas
variants of
un
concern,
chiffre
there are a
exact
number of
qu'on
concerns.
peut
There's not an
toujours donner une gamme.
exact
Peut-être
number.
le
We can always give
pourcentage,
a
comme dit
range,
le
a
couvrage,
percentage
le taux de vaccination.
for the
Mais je pense que c'est
vaccination
plus
rate, but I
important
think it's
de
more
peut-être
important
analyser les autres chiffres.
to
C'est quoi
analyze the other
l'impact sur
numbers.
la maladie grave et les décès? Parce que
What is the rate
le but
of
vraiment
serious illness
jusqu'à date, les données
and
probantes
death?
démontrent
Because
que
the scientific data shows that
même une dose de vaccin
even one dose of
donne un bon niveau de
vaccine
protection
gives a good level of protection
pour les personnes à risque. Donc,
for
c'est quelque chose à
at-risk
suivre.
individuals, so it's
C'est quoi
something to
le
look
taux
at. What is the
d'hospitalisation,
rate of
maladie grave,
hospitalization
aussi les décès. Je pense
and the severe
même à date,
illness
avec
and death?
l'expérience,
And
c'est peu
with
limité avec seulement quelques mois. Mais
our experience is limited to a few months, but
la Colombie-Britannique
in British
aussi au
Columbia
Québec avec
and in
les
Quebec
CHSLD, on a
with
des
CHSLDs,
donnes
there
résultats après même une dose de vaccination pour les résidents. Donc, je pense que
there
ça,
was
c'est
significant
la
improvement
chose
even
la
after
plus
one dose
importante. Mais
of
deuxième
residence.
chose
The
aussi importante, c'est
second
et c'est
important
pas
thing,
seulement, comme on dit, je ne sais pas en français, mais en anglais, c'est pas de silver bullet. C'est pas
it's
seulement
not a
la
silver bullet.
vaccination qui
It's
est
not just
important,
vaccination that's
toujours important
important.
maintenant aussi
It's
à
still
continuer
important to
avec les
continue
bonnes mesures
to
de santé
follow
publique aussi
public health practices
pour les personnes à l'échelle individuelle parce que on ne sait
for
pas maintenant,
individual
même avec le
behavior,
vaccin,
because we know that even
c'est quoi
with
l'impact sur la
vaccination,
transmissibilité. Je pense
we're
que
not
oui,
sure
ça
what
donne
the
une bonne
impact is on
protection
transmissibility.
si on parle des maladies graves et les
If we
décès,
look at
mais
serious
c'est encore,
disease and
comme on dit,
illness,
une question ouverte. On n'a pas
it's still an
vraiment
open question.
assez de données
We don't
probantes
have
pour
enough scientific data
montrer que
to demonstrate
c'est aussi
that
c'est aussi un effet efficace pour la
vaccination
transmission. Et on
reduces
voit
transmission.
maintenant à l'heure actuelle, qu'est-ce qui se
And
passe
we're seeing
en
currently
Colombie-Britannique.
what's happening in
On voit il y a
BC.
quelques éclosions, même
There
dans
are a couple of
les
outbreaks
CHSLD ou l'équivalent
in
en
long-term care
Colombie-Britannique,
facilities
même
in
parmi les
British
résidents
Columbia
qui ont été
among
vaccinés. Donc,
residents
je pense
that
que
were
c'est quelque chose
vaccinated. So I
suivre
think that
aussi
that's something that needs to be
voir
followed
qu'est-ce qu'il faut
to
faire pendant
determine
les semaines et
what we need
les
to
mois
do
à
in
venir.
the coming
Merci.
weeks and months. Thank you.
Merci. Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de David Aiken de Global News. Please go ahead. À vous la parole.
Thank you very much. It's always like winning the lottery when your operator calls out your name. Just a quick observation, folks. All three of you, when you presented, you were clearly reading off remarks. It would be of great benefit if you could circulate those remarks to all reporters ahead of you, particularly General Fortin. You had so many numbers in there. It's so important we get these numbers accurate. And to the officials who are providing us with the background materials, they're wholly inadequate. 4 charts. They don't show anything in April. So there's my observation. First question for for General Fortin is you talked about a rehearsal yesterday, and you were going very quickly through this. So I'm very curious if you can go back to this rehearsal. This rehearsal was for which specific vaccine? Can you discuss exactly what was going on? Was it beyond logistics? Did it get into how the provinces might be booking appointments, telecommunication systems to handle people calling in for appointments? Can I get a little more detail on the rehearsal?
Yes, thank you. And noted. I would also admit that we have been posting information on Canada.ca website for all Canadians to see. We could probably consider ensuring that we have the up-to-date information and the frequency of the update, frequency of the refresh is reviewed. But it's so the ramp up. Sorry, the rehearsal concept that we executed yesterday. You might recall we did something similar back on December 11th. At the time, we were just about to start with the first vaccines. In fact, 3 days later, we were vaccinating the first Canadians. And at the time, it was oriented mostly on Pfizer. Moderna was yet to arrive, but approved. And additional vaccines were still something that was very hypothetical. It was down the line, probably into March, April, May timeframe. It was identified in our plan that there would come a point that might align with Q2, that the second phase of our distribution or our immunization plan would kick in. And that second phase is characterized by additional vaccines coming online and volume, significant increase in quantities into the million a week. That's very much where we are this week. So I would carefully say that we're stepping into phase 2 today. And it was identified several weeks ago that as a culminating event, we should bring together representatives from provinces and territories and various other groups. And you never have enough people around this virtual table. But we had an opportunity with 180 participants to share thoughts and ideas, and dive into the areas that I indicated where provinces had an opportunity to share insights on collaborative planning with Indigenous partners, as well as reaching out to racialized and marginalized population. It's applicable to many. It's certainly we had an opportunity to discuss the specifics of Ontario and Toronto, greater the GTA. Scheduling appointments where we had an opportunity to hear from different perspectives and generating solutions to health workforce challenges, which is very much something that all provinces are paying attention to. That's not the end of it. We need to have additional discussions coming out of this rehearsal where we'll further crystallize our plans. There are bilateral engagements that will take place over the next week or so. Our colleagues in provinces and territories are looking forward to have more discussions on that, share best practices, and learn of additional thinking that we have here. It's very important to have an opportunity to work together on this through those tables, in addition to the existing very comprehensive tables that we have, where health professionals have an ability to identify key issues. Our team, my team, is very much focused on the distribution system and helping provinces with their immunization plan any way we can federally.
Thank you. Next question. Oh, sorry, follow-up, I should say. David?
Sorry, I unmuted. There. Thank you for remembering me. Won the lottery for a second time. I love it. I guess, General Fortin, thank you. That was a very helpful answer. And I guess my second question sort of falls from that. Again, recognizing that obviously the task force is involved mostly in distribution, et cetera. I'm wondering if you can speak to the something new in that the scientists have indicated that the dose interval for the 2-dose vaccines can be extended to 4 months. And I wonder if you could speak to whether or not that has had any impact on, for example, which Moderna doses go where, or Pfizer doses, or the AZ vaccines. Has that new reality of extended interval had some impact on how the distribution process is taking place?
No, it doesn't have any impact on the distribution process federally. It will have an impact on how provinces manage their allocation, where to prioritize it, so that it gets to Canadians as rapidly as possible.
Thank you. Merci. Prochaine question.
Thank you. Merci. Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from, la prochaine question est de Marie Vassel de Le Devoir. Please go ahead, à vous la parole.
Oui, bonjour. Ma question, je pense que c'est pour Mme Paquette. En fait, j'aimerais revenir sur la question de Mackenzie Gray il y a un bout de temps, mais en fait, sur les vaccins de Johnson & Johnson, je comprends que vous n'avez pas encore de date fixe ou de quantité fixe à nous annoncer, mais juste pour avoir une idée, ces nouveaux ces délais-là de production, ces problèmes de production dont on apprend l'existence, est-ce que ça a changé le moment auquel vous attendez des premières doses? On parlait la semaine dernière, il me semble, du deuxième trimestre, que ça commencerait à arriver au deuxième trimestre. Juste avoir une idée, est-ce que ça c'est retardé ou pas?
Merci pour la question. Et d'après nos discussions, ce n'est pas retardé, mais nous sommes toujours en discussion avec la compagnie pour déterminer les dates exactes par lesquelles nous allons recevoir les prochaines doses, les premières doses.
OK.
Merci.
Merci. Et Maj Gen Fortin, sur la pratique, je ne sais pas comme ça vous l'appelez en français, mais la pratique d'hier sur l'administration des vaccins dans les provinces, pouvez-vous nous donner une idée de combien de doses, en vertu de cette phase 2 dans laquelle on entre en ce moment, comme vous dites, combien de doses vous prévoyez pour être administrées par jour au Canada, dans toutes les provinces? Est-ce qu'on a une idée de la quantité de doses à laquelle on passerait avec cette phase 2-là pour voir si on peut éventuellement accélérer assez pour devancer, dans le fond, la vaccination de tout le Canada?
Alors, on n'est pas entré dans ce niveau de détail-là dans notre pratique hier. Par contre, il y a quelques jours, on a fourni des tables de projection mises à jour aux provinces, des projections, des courbes de projection, des quantités pour fin de planification qui leur permet de mieux planifier et plus longtemps à l'avance la distribution potentielle un peu partout à l'intérieur de leur juridiction, aligner le nombre et le type de cliniques qu'ils vont mettre en place, le personnel requis, vaccinateurs et personnel de soutien, et comment tout ça va être synchronisé avec les différents vaccins. Alors, on n'a pas déterminé hier une cadence, déterminé un nombre précis, mais les provinces ont des quantités prévues auxquels d'autres vaccins seront ajoutés. Alors, on a ces tables de projection qui leur permettent de visualiser un maximum potentiel selon les données telles qu'on les connaît aujourd'hui, avec des quantités de vaccins qui demeurent à arriver, mais on peut s'attendre que ça n'arrivera pas avant telle ou telle date. Alors, on peut projeter vers l'avant. Et puis, si on apprend que certains vaccins sont disponibles plus tôt, alors on pourra s'ajuster. Mais c'est important qu'on ait ces données de planification-là dans les mains des provinces. Et puis les provinces maintenant sont en train de continuer de peaufiner leurs plans et qui seront en mesure de s'ajuster au fur et à mesure qu'on progresse.
Merci. Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Colin Perkle de Canadian Press. Please go ahead. À vous la parole.
Thank you very much. My first question is, barring any sort of major disruptions in supplies of the vaccine, do we have any projections at this point of when we might expect to cross, say, the 37.5 million mark?
Yeah, it's General Fortin. I think with the numbers that we shared earlier, we can see that we are well on track to receive a significant quantity of vaccines by the end of June. And that's the information that we're planning against right now. So at least 25 million of of the mRNA vaccines, the Pfizer-BioNTech and Moderna vaccine. And additional vaccines, as I had described, 1.5 million of AstraZeneca. So those are the data, the pieces of information that we are working with right now. And pending any, barring any issues with production, I think we're well on track to have those quantities delivered. And therefore, provinces and territories in a position to immunize their people at a good cadence with that flow, with that predictability of quantities over time.
So we don't have any projections at this stage about when we will have at least one shot for every Canadian to have delivered.
Well, again, I'm not going to speak for provinces and territories and their immunization plan. That's very much for them to comment in detail by jurisdiction. But just numbers alone give you a sense of the quantities that will be available over time. So between April and June, those quantities will allow provinces to execute their plan and vaccinate Canadians quite effectively. And depending on where they land on the dose spacing, that's for them to decide, and it may change over time. So I'm not going to speculate as to when they will meet that target.
Thank you. Merci. This is the end of our technical briefing. C'est ce qui termine notre briefage technique pour aujourd'hui. Je vous souhaite une bonne journée. Have a good day.